Well, health and nutrition is just one area factored into a study that ranks Oklahoma children 40th in the nation in overall well-being. Earlier, I sat down with Amber England, the policy director for the Oklahoma Institute for Child Advocacy. Well, Amber, the latest 2012 Kids Count data is out, and some would say it is better than before, but still not probably where we want to be. Tell us about it.
Yeah, the 2012 Annie Casey Kids Count data comes out annually from a national foundation who's one of our funders at OICA, the Oklahoma Institute for Child Advocacy. We did see some improvements in things like access to health care for children. We do a really good job in Oklahoma of making certain that our kids are covered, which is really, really good, because that's not so much for our adults. We have a lot of uninsured adults, but for the most part, we have really good coverage for kids in Oklahoma. Overall, we're 40th in child well-being. That puts us in the bottom percentage amongst all states. We would love to be the best state in the nation to live, work, and raise a family. And in order to do that, we have to get these numbers up.
And we have some numbers that break this down more categorically, and let's go ahead and put those up on the screen. We're 29th in economic well-being, 39th in education, 40th in family and community, and then 44th in health. But there was a big improvement, a 23% decrease in the number of children without health insurance. It dropped from 13% down to 10% in 2010. We know this is a social issue, but is it not also an economic issue?
It absolutely is an economic issue. I think when people approach these issues as children's issues or as social issues, they're actually missing the mark, because this is the biggest economic development tool you have, is investing in child well-being, because they are your workforce for the future. And so if we're 44th in overall health and in child well-being, and we're 48th in overall health in the country in terms of just children and adults, what does that say to people who want to bring their businesses here and know that they're going to have to count on employees being well and being able to show up to work? It's absolutely an economic issue. Education, again, it's an economic development issue. We know when kids graduate from high school and go on to graduate from college, they earn more over a lifetime, and that just means that we have a better economic outlook in the state. So I would argue absolutely that every single one of these indicators needs to be improved, because it matters to the economic well-being of our entire state.
Yeah, and hitting these higher marks is not something we need to start working on in high school either. We're actually talking about before children even reach school?
Absolutely. Giving a kid a smart start in life, and one of the initiatives that actually was born out of the Oklahoma Institute for Child Advocacy was the Smart Start initiative. The Potts Family Foundation does a lot of work with birth to 3, just to make certain that child development, we know their brains develop so much in those early years, and if we can make certain that from birth to 3 that they're getting, healthy eating, and they're getting, love and affection the way that they should, that it really makes a difference. Later on in life, they get better grades, they behave better in school, and they earn more over a lifetime.
Where does poverty figure into this?
Poverty plays a huge factor in overall well-being in Oklahoma. Some of the statistics from the Annie Casey Kids Count data this year are pretty alarming when it comes to Oklahomans living in poverty. 1 in 4 Oklahoma children live in poverty. That's up from last year. And the number of children who grow up in economically disadvantaged areas, which are people around them living in poverty, is up. And also parents who lack secure employment is increased in the state of Oklahoma this year. Despite the fact that we've done well in the economic recession, there are still families that struggle to make ends meet. We have to look at what sort of policies that we can support that will help lift these numbers up, but will also help lift these families living in poverty into the middle class.
So Amber, we're 44th in the overall health of our children. What can we do to improve that?
Well, the Institute for Child Advocacy has a statewide initiative called the Fit Kids Coalition. I'm sure you're familiar with it. It's done some great work in its history. And this year we worked with the American Heart Association to pass a bill that would eliminate liability concerns for schools who kept their lights on and their doors open at nights and on the weekends, for families to come and have a place, a safe place to be active and physically active and just move a little more throughout the day. We know that there are real barriers Oklahomans face when trying to make that choice to be healthy. And one of the things that a community can do is turn to existing facilities that are already there. And what is in every community? A school. I mean, the schools are typically the heart and soul of a community. And so that shared use legislation is paving the way for schools to keep their doors open without being fearful of a lawsuit or costs that might be associated with it, because the legislature passed the bill. The governor was strongly in support of it, mentioned it in their State of the State address, and it's paved the way for us to go out and do some work throughout the state to educate Oklahomans about shared use agreements and how that can happen in their communities.
All right, thank you so much. Amber England.
Thank you.